A simple sore throat can silently damage your heart for life. Let us uncover the acute rheumatic fever in this video. What is acute rheumatic fever? It is an autoimmune reaction triggered by group A streptococcus causing pharyngitis, primarily affecting the children aged from 5 to 15 years. Uh, Rheumatic heart disease is a permanent valvular damage in lasting legacy. RHD affects 15 to 19 million people worldwide, causing 250,000 deaths annually. An autoimmune mechanism, molecular mimicry between group A streptococcus, M protein, and cardiac tissue triggers immune-mediated damage. The culprit for the acute rheumatic fever is group A streptococcus. The key facts are primarily causes pharyngitis. The recurrent pharyngitis can lead to the acute rheumatic fever, the sore throat, and scarlet fever. Only pharyngeal group A streptococcus infection triggers the acute rheumatic fever. Impetigo is not associated in acute rheumatic fever. Certain M serotypes like M1, M3, M5, M18 historically linked with rheumatogenic. Any group A streptococcus strain can potentially trigger ARF in susceptible individuals. Host susceptibility. Genetic predisposition, environmental factors influence who develops acute rheumatic fever and the group A streptococcus infection. The trigger, a common bacteria, a devastating reaction. What begins a routine sore throat can, in susceptible individuals, unleash an autoimmune cascade targeting the heart, joint, brain, and skin with consequences lasting a lifetime. Let us see Jones criteria. Jones criteria have major and minor criteria. Diagnosis requires two major or one major plus two minor criteria to diagnose acute rheumatic fever. Major criteria for the Jones criteria are the mnemonic for it is Jones, where the J stands for joints. Migratory polyarthritis starts in knees and ankles. O stands for heart, that is carditis valvulitis. N for nodules, that is subcutaneous nodules, painless lumps over bony prominences. E stands for erythema marginatum, trunk rash with wavy borders and clear centers. And S for syndromes chorea, which includes involuntary jerky movements and late manifestations. And the minor criteria for acute rheumatic fever are the fever, typically more than 38 degrees Celsius, arthralgia, joint pain without swelling, elevated ESR and CRP levels, acute phase reactants, prolonged PR interval on ECG. The supporting evidence for group A streptococcus infection are positive throat culture for group A streptococcus, rapid antigen detection test, elevated or rising ASO titer, elevated anti-DNase B titer. ARF can present without positive throat culture. Serology, ASO is often only the evidence for the ARF. The clinical manifestations of ARF are carditis. It occurs 50 to 70%. Pancarditis with valvulitis, new murmur, pericardial friction rib, CHF, echo detects subclinical carditis. Arthritis, migratory large joints are involved like knees, ankles, elbows. resolves without permanent damage. The chorea, it is jerky movements, it's often late sign like 1 to 6 months after the infection of streptococcus. Skin manifestations like erythema margitemnum and the subcutaneous nodule, rare but highly specific in this ARF. Treatment and prevention. Uh, there are three phases for treatment. The phase 1 is to eradicate group A streptococcus with penicillin V or IM benzathine penicillin. The phase 2 where anti-inflammatory therapy is used like NSAIDs or corticosteroids are used. In phase 3, secondary prophylaxis where benzathine penicillin is used every 3 to 4 weeks. Secondary prophylaxis duration: no carditis, 5 years or until 21 years of the age. Carditis with residual RHD, 10 years or until age 21. Carditis with residual uh, RHD where 10 years or until 40 age, or sometimes the treatment is lifelong. Critical point is secondary prophylaxis is cornerstone of RHD prevention. Each recurrent ARF episode compounds valvular damage. The global fight against acute rheumatic fever and rheumatic heart disease is disease of poverty, crowded living conditions, poor hygiene, limited healthcare access, drive transmission in low resource settings. The hotspots for the ARF are Sub-Saharan Africa, Pacific Islands, Indian subcontinent and the parts of Latin America bears the highest burden of ARF. Call to action is the enhanced awareness, resource mobilization, coordinated control programs vital to combat the preventable disease that is the ARF. The takeaways from today's video are: ARF is an autoimmune disease. No direct infection, molecular mimicry damages heart, joints, brain and skin. Jones mnemonic is the Jones, that is joint, heart, nodules, erythema and chorea. Uh, Two major or one major plus two minor criteria. Carditis is the killer. In 50 to 70% of cases, mitral valve is most commonly affected. Prophylaxis is lifelong. Long-term penicillin prevents the recurrence and cumulative valve damage. Remember, ARF is entirely preventable. Prompt treatment of streptococcal pharyngitis and adherent prophylaxis can eliminate ARF and RHD. Thank you. If this has made your acute rheumatic fever easy, don't forget to like, share and subscribe. Thank you.